Hello, my name is Dr. Shilpa Singh. I'm from the Department of Forensic Medicine. The topic that has been selected by me today is transportation injuries. It's a very small and a relevant topic of forensic medicine. So what exactly are transportation injuries? It can be an injury which takes place by the use of any mode of vehicle or any mode of transportation. It can be an injury to the driver, to the pedestrian, to the cyclist, to the biker, but they are in relation to modes of transport. So when I start with it, I would like to concentrate more on the injuries that will be sustained by pedestrian. That is a sole topic that is being covered by forensic medicine. So the injuries to the pedestrians can be described under three headings. One is primary impact injuries, secondary impact injuries, as well as secondary injuries. Now, as the name suggests, what are primary impact injuries? The injuries that result from the first part that is struck with the vehicle. That is the part of the body that comes in front of the vehicle first. It depends on the position of the person in relation to the vehicle when it is struck. For example, the injuries that come under this category are bumper fractures or injuries on the legs. Most commonly, tibia is the one that is fractured. The other classification was secondary impact injuries. Now the other injuries that are caused by the vehicle after the primary impact are known as secondary impact. And secondary injuries, the word impact is missing, that is the third classification. Secondary injuries are basically injuries that are caused by the victim's fall or subsequent injury when the person is thrown by the force of the vehicle. For example, abrasions, contusions or fracture of any bone after hitting the ground or maybe the bonnet of the vehicle again. So these are the three types of injuries that can take place to the pedestrian. Moving ahead, I have a very nice diagram that basically explains all these injuries and the subsequent, all these types of injuries that can a person sustain in a transportation injury and the necessary area in which it can happen. For example, the primary impact injuries, they are in dotted places. Like I mentioned, it is most commonly the tibia's fracture, it is at the legs. The primary place that comes in contact with the offending vehicle. The secondary injury, as is rightly mentioned over here, that is once the person is with the impact of the injury, he falls down or he is thrust up in the air and then he sustains the other injuries. These are known as secondary injuries. But secondary impact injuries were the ones that because of the primary impact, the person has again fallen onto the bonnet of the vehicle, and they can be moderate velocity impact injuries. So these can be basically present on the back, on the lower back, and secondary injuries can be present on the hands or maybe on the head because of falling on the pavement. So the medico-legal importance, why are we studying these injuries to the pedestrians? Basically, any imprint abrasion or pattern contusion can help us to identify the offending vehicle because they can be an imprint that is present on the injury. The height of the fracture from the heel corresponds to the height of the bumper from the ground. So that can also, except when the person is walking, so that can also help us to correlate the offending vehicle. Sudden application of brake causes the front end of the vehicle to tip downwards. So that is why we can also concentrate what is the height at which the person has been hit from the ground and the height of the bumper from the ground. The position of the person at the time of impact. These are some of the things that can be rightly answered when we study what are the types of injuries that take place in a pedestrian. What are the injuries what is the medical legal importance of injuries that are because of secondary impact? That is transfer of evidential material, thereby causing a causal relationship. Causal relationship is that it can establish that this was the offending vehicle and this has caused this impact or an injury. So it can establish a causal relationship. The tire marks can be taken up as trace evidences. And the medical legal importance of the secondary injuries is grazed abrasion, for example brush burns, also known as road rash or road rage rashes, that helps in determining the direction of the movement of the victims. This has been rightly taken up in the chapter of mechanical injuries, road rashes, and how it helps us in giving the direction of the offending vehicle. Now there is something which is known as Waddell's triad, basically a classical form of pedestrian injury seen in children who are struck by any motor vehicle. And what is this classical triad? It is a fracture femoral of shaft, it can be intrathoracic or intra-abdominal injuries, and lastly contralateral head injuries. So injury on the feet, injury on the foot, injury on the abdomen or the chest, and injury on the head on the opposite side. So this forms the Waddell's triad, classically seen in children in cases of motor vehicle accidents. This is Waddell and Brooker's triad. It is also known as Waddell's and Brooker's triad. This is a diagram which explains that the fracture femur, intra-abdominal or pelvic injury and head injury together clubbed up is known as Waddell and Brooker's triad. In this picture it is depicted that a child was playing with a ball and he came in front of the offending vehicle, and this is how he was hit. The bumper or the fender fracture, the one that I had mentioned in the previous slide, in the first slide, was the primary impact injuries. We will generally have the fracture of the tibia. So this is a diagram which depicts the bumper, also known as the fender fracture. What happens is the bumper is actually hits the body part first, that is the tibia. And this fracture is generally wedge shaped and also gives us the direction. The apex of the bone gives us the direction in which the vehicle was moving forward. So this is known as bumper or fender fracture. This is another diagram which explains the bumper on the fender fracture. Basically, it is a soft tissue damage and it is a comminuted wedge-shaped fracture of the tibia, usually and sometimes fibula, with the forward displacement of the bony fragments. The base of the triangle fracture fragment will suggest the site of the impact, and its apex will point to the direction of the moving vehicle. The injury to the driver of the vehicle. Now, these were the injuries that I was talking about were of the pedestrian. Now, if we come down to the injury to the driver of the vehicle, there can be a steering wheel injury, there can be windscreen injury, there can be dashboard injuries, there can be whiplash injuries, as well as seatbelt injuries or seatbelt syndrome. So, starting with the first one, the steering wheel injuries. When a driver is now thrown forward, the chest of the driver may strike the steering wheel or the upper abdomen on the wheel rim. So this is known as the steering wheel impact injury. There can be a horn boss fracture, that is the transverse fracture of the sternum. It is just a very fancy term. Or they can be flail chest or a stubborn chest. The lungs may be lacerated or fractured by the ribs, or the fractured ribs may penetrate the lung tissue. They can be crushing of the liver, of the spleen and the kidneys, and they can be ladder tears of the aorta. So this is a very subtle classification in which we can talk about the steering wheel impact injuries. The injury to the occupants of the vehicle of the driver and the front seat, they can also be clubbed under dashboard injuries. The first one was the steering wheel injury. The second is the dashboard, against which the driver or the front wheel passenger can sustain injuries. The most common one is the posterior dislocation of the hip and the joint fracture, and as we can see in the diagram, because of the impact with the dashboard, there is a posterior dislocation of the hip because of the sustaining force. There can be another type of injury which is known as the sparrow marks or dicing injuries. Now this is because when the front seat occupants or the driver, they strike the windshield of the car, there are multiple punctate lacerations of the face. Some books have also mentioned it as abrasion, but more rightly it will be called as laceration. They will be produced due to the shattering of the windscreen and the small glasses that will get embedded into the face of the person. So this will resemble the foot marks or the sparrow marks. The injury to the driver and the vehicle of the front seat continued. They can be lastly seatbelt injuries. So we've talked about steering wheel injuries, we've talked about dashboard injuries, we've talked about the windshield injuries. Now we are talking about the seatbelt injuries. They can be direct injuries like abrasion, contusions, lacerations, hematoma of the lower abdomen, or they can be compression injuries because the seatbelt is not allowing the person to move forward and there is compression of the abdominal organs between the seatbelt and the vertebral column. So we can rightly see rupture of the liver, the spleen, sometimes the cecum and the urinary bladder also. Moving ahead, we can have injury of the seatbelt mark, we can have intra-abdominal injuries, we can also have thoracolumbar vertebral fractures, that they are also known as trans fractures. Now, injury to the occupants of the vehicle of the front seat, they include the windscreen that I've talked about, ejecting from the windscreen, bladder tears of the aorta, dashboard injuries, whiplash injuries and seatbelt injuries. All these we've described properly. Now, if we talk about the rear seat passengers, there can be injuries due to the hitting of the front seat. They can be injuries due to the throwing on the windscreen, and they can also be injuries from interior fittings like door handles or window winders, mirrors and lights. If we talk about the injury to the motorcyclist, they can be a fracture of the head, the spine and the face. They can be a hinge fracture and they can be tailgating or underrunning of the vehicle. The tailgating injuries are nothing, it is just a fancy term when the motorcyclist hits at the back of a heavy vehicle like a truck or a bus at a very high speed. The head and the shoulders are smashed against the tailboard, and in some cases even decapitation can occur. So this is known as tail capping injuries of a motorcyclist. And the motorcyclist fractures, we've also read about it in regional injuries of the head and fractures of the skull. The base of the skull is divided into two halves. It actually makes like a hinge, and hence it is also known as hinge fracture. With this, I thank and wrap up my chapter for today. Thank you for listening to me.